Hello everyone, I'm Dr. Armin Khavandegar, a medical doctor and medical researcher. Welcome to the Lancet Summer YouTube channel. Here we are with Dr. Payman Salamati, a specialized in the field of preventive and social medicine and professor at Tehran University of Medical Sciences. In this YouTube channel, we are going to summarize medical hot topics recently published in the Lancet journal. Dr. Salamati, what topic are we going to talk about today?
Hi everybody. Many thanks, Armin. It's my pleasure to be here and present a new paper called Large Language Models, a new chapter in digital health. It's the editorial of the Lancet Digital Health and it was published in January 2024.
To the best of our knowledge, large language models or LLMs was first drawn worldwide attention in 2022. Could you please explain about it?
For sure, ChatGPT, a large language model, or as its abbreviation LLM, was released in November 2022, and its version in that time named GPT 3.5, and its users could reach to 1 million during 5 days, and now its users are about 180 million. In fact, the global interest to LLMs is due to their extensive capabilities.
So we know that in 2023, LLMs had many various types of achievements. Could you please tell us more about your prediction of their capabilities to help health sectors in 2024?
LLMs can help us in many ways. For example, Singhal and his colleagues reviewed MedPal, a kind of LLM for answering medical questions, and they found that MedPal was able to answer 67% of US medical licensing exam questions. For passing the exam, you should answer 60% of the medical questions. And a couple of days ago, I reviewed the related site, and I found that the new version of MedPalm 2, was able to answer about 86% of the medical questions, and these numbers are fantastic.
And about the usage of LLMs in education, what do you think of it?
To be more precise, LLMs can help us in numerous ways. For example, Lim and colleagues studied some LLM chatbots, and they found that these types of LLMs were able to answer the questions of the patients with myopia. Moreover, Goodman and colleagues assessed GPT 3.5 and GPT 4, and they could get up-to-date and accurate answers about 17 medical specialties.
How can LLMs help in other fields of medicine?
LLMs can do some administrative tasks for us, including checking health insurance, authorizations, scheduling next meetings, and prescription. You know that they can do them automatically, and in this way they can liberate medical staff's time. Likewise, they are able to summarize discharge notes, because you know that one of the tough tasks in medical fields is writing medical summaries of patients' medical records, and LLMs are able to review the content of medical health records and summarize them. Also, they can review the medical health records and answer to some of the patient's questions and deliver some summaries to them.
So, are there limitations for employing LLMs in all fields?
Certainly, LLMs have some limitations in producing clinical images. LLMs are not able to distinguish demographic diversities among different populations, and as a result, they can copy and produce stereotypical images. Also, scientists found that GPT-4 had some biases and they could produce some incorrect and nonsensical answers, a phenomenon which is called LLM hallucination. And you know that it's dangerous for the patients with limited knowledge.
And about open source data and codes LLMs, could you please explain more about it?
For sure. You know that most of LLMs are not open source code and data, and they are necessary for transparency and collaboration. However, there are some concerns about such LLMs, including intellectual property, commercial interest, data privacy, and data costs. Happily, the authors provide a link in this paper, and if you click on this link, you can access to a list of open source code and data in the field of medicine.
In summary, what contribution do you predict that LLMs will make to the field of medicine in 2024?
LLMs are able to answer our medical questions. They will help physicians for diagnosis and treating their patients, and they can do some clerk functions via automated systems.
So, how do you think the Lancet journal can help LLMs to grow and develop?
The Lancet Digital Health Journal can report some new innovations in the field of LLMs. It can focus and highlight some biases and limitations about LLMs, and it can evaluate clinical implementation, cost effectiveness, and ethical issues of LLMs.
Thank you for your explanation. Thank you for watching us. Once more, the goal of this channel is to summarize medical hot topics recently published in the Lancet journal. Don't forget to like this video, subscribe our channel, and leave your comments below this video. Thank you.